tuberculosis. We've got a 47-year-old man presenting to the emergency department with 2 weeks of cough, hemoptysis, and night sweats. Recently from Vietnam, country with high prevalence of TB. And we're going to see that he has tuberculosis. And the examination reveals crackles and rhonchi over the right upper field, and the chest x-ray shows a cavitary lesion. Sputum samples are obtained, and 2 out of 3 show acid-fast staining. However, a tuberculosis skin test performed shows 0 in duration at 72 hours. Okay, so that's really interesting because a type 4 hypersensitive reaction with tuberculosis skin test should show positive. However, about 25% of patients with tuberculosis have a negative tuberculosis skin test. It's called anergy. That's whenever you don't have a big response. And so it's asking us to best explain this phenomenon. All right, so A, we don't really need to know this one, but that's like a vaccination that uses Mycobacterium bovis, which has antigens with tuberculosis that are in common. And so if you have a BCG vaccination, you can have false positives, but you would never find false negatives. So it would not be this one. Deficient humoral immune response. So a TB infection is controlled with the macrophages and the T lymphocytes. And the humoral immune system has a small role, but it doesn't contribute to that in duration. And so an antibody disorder or like humoral immune response is not going to be the right answer. The correct answer is going to be an impaired T function due to energy. Okay, so let's explain this a little bit. You have the symptoms of active pulmonary tuberculosis. How do you know? Well, the hemoptysis, night sweats, and upper lobe cavitary lesion. That should cue us into it, as well as this acid-fast stain. But the negative test is due to energy because the impaired T response happens in like a fourth of people. And so you're just not going to get that hypersensitivity reaction because the T cells are just not responding. Yeah, it's a type 4 hypersensitivity reaction, functional cell mediated response with T cells and macrophages. And let's look at the other ones, like insufficient time delayed. It should be able to read at 72 hours. And if it's not, then it's anergic. Infection with non-tuberculosis bacteria, that would be like the MAC infections. So if you have, for instance, a mycobacteria, that can cause a false positive, but it would never cause the false negative. That's kind of similar to the option A. And so hopefully this is helpful. Basically, you need to know that there are false negatives due to energy in 25% of tuberculosis patients. And that's pretty much it for this one. I mean, it's also helpful to know that the stains can key you into, the acid fast should key you into tuberculosis and hemoptysis as well. Other than that, it's kind of it for this question. So if you thought that this content was helpful, like and subscribe. And then let's see what else. Hemoptysis is like the coughing of blood. All right, well, that's all. Take care.